Welcome, medical students, to today's lecture on abdominal radiology. In this comprehensive script, we will delve into various aspects of abdominal radiology, covering topics ranging from the introduction to different abdominal pathologies and their imaging protocols. So, let us begin our journey into the fascinating world of abdominal radiology. Abdominal radiology plays a crucial role in diagnosing and guiding the treatment of various pathologies affecting the abdomen. It encompasses the use of multiple imaging modalities, such as radiography, ultrasound, computed tomography, CT, and magnetic resonance imaging, MRI. Abdominal imaging provides vital information about the anatomical structures, pathophysiologies, and abnormalities present within the abdomen. It helps in the identification of organ-specific diseases, assessment of trauma, evaluation of abdominal pain, and monitoring the response to therapeutic interventions. To understand abdominal radiology, it is essential to have a sound knowledge of the abdominal anatomy. The abdomen consists of several vital organs, including the liver, gallbladder, pancreas, spleen, stomach, intestines, kidneys, and adrenal glands. Each organ has a unique anatomical location and serves specific functions in the body. Abdominal pathophysiology involves the disruption of normal physiological processes, leading to various diseases and disorders. These pathologies can result from inflammation, infection, neoplasms, ischemia, trauma, or congenital anomalies. Additionally, in cases of suspected bowel obstruction, a combination of radiographs and CT scan may be used to identify the site and cause of the obstruction. Other imaging modalities such as MRI or nuclear medicine scans can also be utilized in certain cases, depending on the clinical scenario. It is important for medical students to understand the appropriate use of imaging modalities and protocols in acute abdominal pain, as this knowledge can aid in the timely and accurate diagnosis of patients, ultimately improving patient outcomes. Bowel obstruction is a potentially serious condition that requires urgent intervention. Radiological imaging plays a crucial role in confirming the diagnosis, determining the level and cause of obstruction, assessing complications, and guiding treatment decisions. The imaging approach for bowel obstruction typically starts with plain radiography. This initial assessment helps in identifying the presence of gas-filled distended bowel loops, air fluid levels, and signs of bowel ischemia. However, other modalities like CT scan or fluoroscopy may be required to further characterize the obstruction and guide management. Appendicitis is one of the most common abdominal emergencies, necessitating accurate and timely diagnosis. Imaging modalities assist in identifying the inflamed appendix and assessing potential complications, such as abscess formation or perforation. The primary imaging modality for suspected appendicitis is ultrasound. It provides a valuable tool for visualizing the appendix, assessing its diameter, detecting associated fluid collections, and ruling out alternative diagnoses. However, in cases of equivocal or complicated appendicitis, a CT scan is often performed to provide detailed anatomical information and aid in surgical planning. Diverticulitis refers to the inflammation of diverticula, which are small pouches that develop along the colon. Imaging plays a critical role in confirming the diagnosis, evaluating the extent of inflammation, detecting complications, and assessing response to therapy. The initial imaging modality for suspected diverticulitis is CT scan. It helps identify inflamed diverticula, wall thickening, pericolonic fat stranding, abscess formation, and complications such as perforation or fistulae. In certain clinical scenarios, an ultrasound or MRI may be considered as an adjunctive or alternative imaging modality. Acute cholecystitis is inflammation of the gallbladder due to gallstone blockage. Ultrasound is the preferred initial imaging test, helping to visualize the gallbladder, identify gallstones, and assess inflammation. Other tests like HETA scan or MRI may be needed for further evaluation. Mesenteric ischemia is a condition where the intestines don't receive enough blood supply, leading to potentially serious damage. Timely diagnosis is crucial, and imaging is essential for this. CT angiography is the preferred method to visualize the mesenteric vessels, identify blockages, assess bowel perfusion, and detect ischemic changes. In certain cases, conventional angiography may be necessary for therapeutic interventions. Renal colic is characterized by severe flank pain caused by urinary stone obstruction. Accurate imaging plays a crucial role in identifying the presence, location, and size of stones, assessing associated hydronephrosis and detecting potential complications. The initial imaging modality for suspected renal colic is non-contrast CT scan. It provides excellent visualization of urinary stones, delineates the urinary tract, and helps evaluate for complications such as infection or ureteral obstruction. Alternatively, ultrasound and intravenous urography may be considered in select cases, particularly when radiation exposure needs to be minimized. In acute pancreatitis, imaging with abdominal CT scan using contrast is the preferred method to diagnose, assess severity, detect complications, and monitor treatment response. Ultrasound or MRI can be used in certain situations for additional information or to assist with procedures. Acute abdominal trauma requires rapid and accurate imaging to guide appropriate management decisions. Imaging modalities play a crucial role in identifying injuries, assessing their severity, and detecting associated complications. In the setting of acute abdominal trauma, the initial imaging modality is often a focused assessment with sonography for trauma, FAST, examination. FAST helps identify hemoperitoneum or other free fluids that indicate significant intra-abdominal injuries. However, more comprehensive imaging with CT scan is usually required to guide definitive management, particularly in cases of high-energy trauma or equivocal findings. Gastrointestinal perforation refers to the rupture or puncture of the gastrointestinal tract, which can be a life-threatening condition requiring immediate intervention. Imaging plays a crucial role in detecting the site and cause of perforation, assessing associated complications, and guiding treatment decisions. The imaging modality of choice for suspected gastrointestinal perforation is CT scan. It allows identification of extraluminal air, abscess formation, pneumoperitoneum, and the extent of associated inflammation. Moreover, other imaging modalities like fluoroscopy or contrast enemas may be performed to provide further characterization or guide interventions. In conclusion, abdominal radiology is a complex field involving imaging evaluation of various abdominal pathologies. This video has covered topics ranging from anatomy to specific conditions. Understanding abdominal radiology principles enhances patient care and accurate diagnoses. Thank you for your attention, and let's continue exploring medical imaging.